Nobody tells me my cheek filler looks amazing. I know it does.
Because I don't know how to build a house.
You're not picking up your groceries with your forehead.
Almost like a sports bra.
A wrinkled lady with some lip filler.
10 times out of 10, you're going to love it.
Or waterboarded with, anatomy.
And I think that's why we love filler so much, is because that result can be dramatic and instant.
Peanut heads are out.
I've been doing a lot of tips.
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way.
Welcome back, everyone. This is one of my favorite topics to talk about. It's one of my favorite things to do in the office, and that is the art of a consultation and what goes into it. These are absolutely hands down, I think, my favorite appointments because you really get to know someone really well, really just dig deep into what their concerns are, what they're looking for, what their life looks like. And I think it'll be interesting for all of our audience, injectors, patients, whoever, to hear what goes into a consult, what goes into a treatment plan, because it's not just random things that we put on a piece of paper. It truly takes a lot of, education, resources, and really digging deep. And that's why I love a consult.
Yeah, you'll get to understand why we suggest the things that we suggest, why we don't just slap a few units of Botox in your forehead, even though that's what you initially came in for. And all of the layers that we're looking at to make you look more natural. It's not just a sales pitch. It's truly for you to look as natural as you possibly can. We are very natural injectors. We want our patients and ourselves to look like themselves, just better. And so just a rule of thumb too, take this, whether you're in Florida, whether you see us as patients, really truly take this, and when you go to a consultation next, remember, because if someone is just selling you on one thing, or if they are just looking at one area of your face and saying, okay, yep, sure, then maybe you need to reevaluate.
Right.
In my opinion, I think you will look the most natural if your injector takes a full facial approach.
Yeah, I think that it gets a bad rap on TikTok, and it's like,
like facial balancing does?
Yeah, it's like, if this person only wants lip filler, then just give them that. But I think that what people don't understand is the way that you look natural, just like you said, is by treating the entire face. I think it's more salesy for you to walk in, tell someone what you want, they give it to you, they just made $800, $1,000, and you get to walk out the door, versus we are going to sit down, take the time, listen to you, understand, educate you on what's happening, and make a treatment plan that's going to make you look like the best version of yourself, and not just, a wrinkled lady with some lip filler.
Yes.
So,
it's actually very easy, much easier on us to just do that lip filler.
Yeah.
What takes a lot of time and effort and brain power, which is why I'm probably exhausted every day after work, is coming up with that treatment plan, is bringing you through the 5 layers of the face and educating you. Lauren and I are so passionate about education. So if you don't want that, we're probably not your girl. But let's dive into it.
When you come in, that's what you're going to get.
Yes.
And even if you've been a long-term patient, you're still going to get it.
You are, always.
So the first part of the consult starts with the aging process and just understanding the aging process. And I think Megan and I probably take a very similar approach in explaining that. So we're going to explain that to you guys today, and then we'll talk about how we kind of make a treatment plan from there.
Yeah.
So the first layer is that layer that you see. It's the skin. It goes skin, superficial fat, muscle, deep fat, bone. So as injectors, we want to hit all of the layers of the face to make sure that you have the best results. So let's start with skin, because it's my favorite layer.
It's our favorite. So we are assessing your skin quality. We're assessing the tone of it. We're assessing the pigment. We are assessing redness, rosacea, anything, any skin concern we are going to assess. From that point on, do you have, deep wrinkles? Do you need a laser? And we'll get into all of that. But really looking at the skin as an outward appearance.
Right. It's always what I feel like start with.
Yes, this is your foundation. If, again, if your injector or your medical provider doesn't assess your skin, there's something wrong.
Mm-hmm.
Your Botox, your filler, your CO2, your Sculptra will look 100 times better and will last if your skin is
Looks
good, is
better.
healthy. Think of it as building a house. Like your skincare is that foundation. You don't build a house and build the outside first.
Right.
You build it with, well, I don't really know because I don't know how to build a house, but you lay the bricks, you lay the foundation, you
Right,
lay the
right.
cement. That is what your skincare is. So if you can
Building
remember
that
that,
routine,
it is
yes.
not a sales pitch. It is not an upsell. It is not buy
It's
skin.
necessary. It's a
Yeah,
necessity.
exactly.
We get compliments on our skin every day. Your skin looks amazing. Nobody tells me my cheek filler looks amazing. I know it does. They don't see that though. And so when you're walking around, people, if your injections are done right, don't see your cheek filler, don't see your lip filler, but they absolutely see your skin.
Yes.
And it is what radiates like beauty.
Mm-hmm.
I just like will never get off my soapbox. Thankfully, neither will Megan on skincare.
And we actually covered a study that we found based out of Asia, where they basically had someone that had pigment, they had someone that had wrinkles, and they asked people, what do you perceive as older?
Yeah.
And they picked the people with pigment. So
pigment is that first key indicator of aging.
Because it's exposure.
Yes, and you'll see it. I mean, I have patients in their late 20s, early 30s, and you're seeing hyperpigmentation. Not a freckle, it's pigment caused by the sun. It's the first sign of aging, even before a static wrinkle.
Yeah.
So nailing down your skincare routine.
I think a really
Catch us on Instagram doing our skincare routine at all times.
I think a really cool approach now with AI is things like an AI skin analyzer or Vizia.
Yes.
Lauren and I are looking into getting these. We actually had this done at a conference.
It was amazing.
We'll put up our results. Really cool. So this looks
at kudos.
Yeah,
I'm doing great.
Our skin age was younger than our actual age, so that was really cool. It makes it all worth it.
Yeah.
But these Vizias, so basically they scan your face. This is like a 3D component, and they're looking at everything from like your pore size to the bacteria on your skin that's promoting acne to literally your wrinkles.
Redness. I mean, we'll show you for sure because it's 6 different photos, and it also has this true age like scaler, and it'll show you how you're going to age.
Yeah.
And then the funnest part is that age at the end, like what it thinks you are versus what you actually are, and you always want to be the same or younger.
Yeah.
Younger is better, right? Because that's what we all are
also
looking
props
for.
to Sharon, because hers was like,
I know,
like 5 years younger. Shoot. Yeah, her skin looks great.
So building out a skincare routine is what we do with every single patient. And I'm never here to just bash your skincare routine. Like, I think people are afraid that I'm going to tell them to throw everything out. Like, I definitely would not, and don't do that. I think that it's important to make sure your skincare is doing something. That's what I tell patients. You come in with a routine, absolutely fantastic. Is it changing your skin? Have you noticed an improvement? Is your redness better? Is your pigment better? Are your fine lines better? If it's not, it's time to change products, or you're not using something that you should be.
Agree.
And so we will kind of talk about how we build out a skincare routine.
And without getting into the weeds, you guys have heard us talk about it before, but there's a big 3 or sort of a core 4, and that is your vitamin C, your retinoid, your sunscreen, and then really we believe in pigment inhibitors, some sort of like complexion cream.
Absolutely. I think if you can master those, everything else can, I love over-the-counter stuff. People think I don't like over-the-counter stuff, and I absolutely do. Invest in those 4 products that are going to be tip-top, and then add in a moisturizer, add in a cleanser where you can kind of save a little bit, and that will make it really palatable.
Yep.
Skincare is expensive up front, but it lasts for a long time. Some of these products will last you 6+ months. They come out to like, I don't know, $1 a day.
Yeah.
So you can afford it.
Yes.
If you're in our office, you can afford $1 a day, even $5 a day.
You can probably. Okay, so next layer, first layer is skin. The next layer that we don't see is our superficial fat pads.
I know, hot take. I hate the superficial fat pads.
I
don't feel them.
No, we can't. So these are our
Some people
nasolabial
do,
folds,
though.
our jowls.
Yeah.
And these are like sort of our medial compartment.
Yeah, there's some medial compartments to the cheek. Some people do fill superficial fat pads, like superficial cheek fat pads. I'm a kind of a deep fat pad
Me too, and
revolumizer.
we can get into that now or when we talk about the deep fat. But like Lauren said, there's the superficial, the deep. Some people will inject the superficial. We don't, because we know that these superficial fat pads they descend. And so that's why you really see a nasolabial fold. You
Mm-hmm.
haven't just like developed or like gotten, heavy in your face to where you get this thing. It's literally from your tissue coming down and in. That
Right.
is a part of the aging process.
And
So,
they move. I think that's a really key component to the superficial fat is it's mobile. It moves. When you smile, that's how people got really weird chipmunk looking cheeks. When you smile, your muscles help your face to move, but those fat pads are moving. So if you pump the superficial fat pads full of cheek filler, then you're going to see it as you
mhm,
animate.
mhm.
And that's where a lot of people started to look weird and we started dissolving. So that's just like our take. We
Yeah.
kind of approach it the same way. But nasolabial folds, jowl fat get bigger as you age. That's why they become more prominent. And then those little fat bags underneath your eyes will kind of pop out. And really the only way to treat that is with surgery. So,
Yeah. So there's
unfortunately.
ways that we can, shadow and contour before that jowl, after that jowl, anterior and posterior to it, so it can look better.
Yeah, it's just an illusion though.
But it is just an illusion. Filler can't lift anything back.
No.
If someone tells you that it can, they're just trying to take your money.
Yeah, PDO threads can't lift either.
We don't believe in lifting only when that involves surgery, and really that's sort of removing excess skin.
Correct.
I don't even know that we can call that lifting. I know we call it a facelift, but nothing. If you're my patient and you come in and you're like, I want you to do this, I'm gonna refer you to a surgeon or tell you that you're
just not possible.
Yeah. Yep. Okay. So
Next
moving
layer,
on,
muscle.
one of our favorite layers, because this is where we
All
put
of
our Botox.
neurotoxin comes into play. So it's exactly like it says. Your muscle ages just like everything else does due to contraction of the muscles. So of course we know our expression lines come from lifting our eyebrows and scrunching and smiling, but even in the lower face, all of those muscles are working. So that's where our neurotoxins come in.
Yeah, and I like to educate my patients and tell them that our muscles down here in the lower face, they actually get hyperactive as we age, which is so weird. You would think that they would want to
They would get
slow down.
weaker.
So when someone comes in or they have a complaint that their the corners of their mouth is sad, it's downturned, that's probably from the hyperactivity of the corner of your mouth muscles trying to pull down.
So, and I think that's a key point. And also, you just made me think of that. It's like listening to, yes, we're educated. This is a short stint. Seems long right now, but like we're talking to our patients about all these 5 layers and what's happening, but then listening to your patient. If they say they feel sad, it's a clue to kind of look around the mouth. If they say they feel tired, it's a clue to kind of look around the eyes, like kind of using those key words, because patients don't always know. They just kind of have that emotion or that way that they feel when they're looking at themselves. And then it's up to you to say, okay, this person feels like that. What am I going to target? So just a little side.
I did want to point out that there is a concern that if you continue to get Botox, your muscles will atrophy from not moving the muscle. Well, when we age, everything atrophies. We know our fat pads atrophy, some of them, and our muscles also atrophy. So I want to age. My muscles are going to atrophy no matter what. So I'm going to stop the harsh muscle movement that is creating the deep lines and maybe get a little bit more atrophy, but you're really not getting...
Who cares? Who cares that your forehead muscle is atrophying? You're not using it to lift anything. You're not picking up your groceries with your forehead. So just chill out. It's okay.
And it really is a genetic thing where some people, I feel like I have a meteor forehead. Whereas other people have these thin forehead. You can just see it.
Yeah.
Anyways, that's a caveat. You can still get Botox throughout your life. It's been studied. It will not change your muscles to a point where your face will just fall.
Yeah, no.
So, anyways.
Then we have deep fat. And those are really where you have your mobile fat pads, or immobile fat pads. I'm sorry, they're static, so they don't move at all. And that's really where we get a lot of our volumization. So all those deep fat pads, and they get smaller over time. so they shrink. So you start to see ligaments that are pulling through the center of the cheek. You really start to see flattening. You start to
Yes.
see this area between your lid and your cheek get longer. And so these are signs of volume loss, and we will re-volumize that area by filling it
Mm-hmm.
and making that light and shadow kind of look better, essentially.
Exactly. That's what you're playing with filler. Filler lately has just gotten such a bad rep, and it is phenomenal.
We're making it better this year.
Yeah, I don't
We're
know,
bringing it back.
we can get into that, but it's so great for revolumization. Everyone needs filler. Like,
Yeah.
really, truly, if you are 30, 40, 50, you probably need some filler.
Yeah.
Anyways.
And then bone. Unfortunately, you lose some bone. So osteopenia, osteoporosis still happens in the skull, and your bone starts to shrink. Your kind of eyes kind of sink back, and these like little maxillofacial bones, they get smaller,
Mhm.
and like we can't replace bone, but we're using filler to kind of help beef back up those fat pads. But you are losing bone as well.
Right. So if you think about your jawline, right now, my jawline, my bone, it's holding back all of this tissue, my muscle. I don't have jowls right now. But literally, as I lose this jawbone, this tissue has nowhere to go but forward. And so that's where we start to see a jowl. No matter how great you've taken care of your skin, or of course you can do sculpture, you can do filler, but truly if you have some jowling here, we need to tighten that skin back, and that's where surgery comes in.
Okay, so we start every consult talking about the aging process, because you have to understand what's happening to your face, and it's happening in the same layers on everybody, but of course, depending on what decade of life you come in, you're at a different point. So I think it's one thing to throw a lot of education at a patient and they like are waterboarded with, anatomy, but then you have to take it a second, so I try to keep that really short with a patient, like skin, skin, fat, muscle, bone, this is all what's happening. And then really, this is where you kind of like knock it out of the park, is your treatment plan. So how are you taking that knowledge and making a treatment plan?
Yeah, and how are they understanding how they'll apply it to their life? They're like,
Correct.
Okay, you just told me that
All
I've
of
lost
this.
some bone and my fat pads are descending, but how do I fix it?
Exactly. So they don't care. I think that it's important to tell them, but at the end of the day, if you just have a bunch of knowledge and you don't know how to apply it, then it doesn't make you a great injector if you don't know how to actually build out one of these plans for patients.
So again, just like we said, that top layer is our layer that we start with first. So we usually start with building a skincare routine. We briefly touched on that, but good skincare, whether it's minimal, whether it's a few more steps, this is going to make everything look better, and then it's going to make the longevity of your treatments, it's going to increase that longevity.
I mean, skincare is 80% of your results, right? Like, we know that it can't do everything, but it is 80%, and it's what you're doing twice a day.
Yeah.
You're seeing us 5 or 6 times a year, but you are doing your skincare twice a day for 365 days. Let's hope. I mean,
we can't come home with you, so you got to do the homework.
You got to do it yourself, and that's really, you're going to get amazing benefits from skincare. I am shocked, but also not. Every single time I put a brand new patient who's never touched a skincare product on, I see them back 2 weeks later. They have already made huge changes to their skin by using really high quality products.
And that's what I wanted to touch on, is it's the quality of the product.
Yeah.
We aren't haters of your over-the-counter products. It's just that there are scientific data relating to the products that are quote-unquote medical grade. So we know that the ingredients that we suggest in our medical grade products are backed by science. We know that they're going to work. And maybe
some are hyped, but some are legit.
Yeah, and I was going to say, like, maybe you see an over-the-counter product that has an ingredient that we've suggested. Well, usually the technology for it to penetrate your skin and treat it is actually going to be stronger, or like more intense, more potent than that over-the-counter product. So again, it's really not like a gimmicky sales thing. These are things that we believe in, that we use ourselves, that will really help your results look
and that we
better.
see results from.
Yeah, we see results because we have the science behind it. So that's the reason why we like quote unquote medical grade products.
Yeah, so after skincare, we're still in the skin, and then we're going to suggest some laser technologies or skin treatment. So Megan and I, I at least am skin forward everything. So let's do your skincare, let's do your skin treatments, before we get into heavy like filler. And
Agree.
so suggesting some skin treatments for patients, which are lasers, microneedling, chemical peels, these are really things that are going to take your daily results to the next level.
Agree. I'm with Lauren. I second that. I would rather treat your skin both with skincare and with a laser before we ever get into filler. I have noticed too over time that excuse me, if we do a laser and then we do filler, the laser has created much more collagen in your skin.
Mm-hmm.
It's made it stronger. It's made it more, stealth, and your filler will look better.
Right.
Your Botox will look better. So I too take a skin forward approach. I think really that's the only way you can go.
Yeah.
I would never, pile filler into somebody if they didn't have that quality skin to hold it.
Yeah, so some of our favorite skin treatments are going to be a Helix CO2 laser, a BBL Moxie to clean up pigment and redness and really just fine tune the skin. Microneedling, I think, is undervalued because it's a big bang for your buck. It's actually one of, I hate to say cheaper, but it's a less investment, but it packs a huge punch.
Agree.
So microneedling one treatment replaces all of the collagen you lose in a year.
Yeah, and this I honestly think, like, if you have realistic expectations of downtime, this could also be
Oh yeah,
a
no
lunchtime,
downtime. Yeah.
a lunchtime treatment. You're a little bit pink. You cannot put heavy makeup on after, but
Right.
get it done and chill the rest of the day. The next day when you go to work, you'll be fine.
Yeah.
Put on a little bit of tinted sunscreen. When we put PDGF with the microneedling, now that is your game changer. If you did that quarterly and had good skincare,
Oh yeah, that's all you would
chef's
need
kiss.
to do. And the value of it is immense and the cost is minimal. $400 to $600 for a microneedling treatment, give or take. And so I think it's not kind of talked about enough, in my opinion. We're spending a lot of money on lasers and everything else, but really microneedling is a great place to start and something that everyone could use in their skin routine.
And just remember that investing in the in-office procedures like microneedling, like lasers, won't do you any good if you don't have the skincare behind it.
Yeah, so skin, wrapping that up. I like to put patients on skincare for 4 weeks or so before we jump into a skin treatment, just so that they can really go ahead and start prepping their skin. And then let's go ahead and do a series of some skin treatments, whether it's a laser or microneedling. And then after that, 2 months or so, let's get you in for some injectables. And that kind of is that next layer.
Yes.
So
now, talking about collagen stimulation, this is sort of that underneath layer of the skin. We're in the deep dermis. This is where Sculptra is great. This is where a CO2 laser can hit as well, even though we said we would have already done that. But
right.
Replacing collagen loss will make you feel like a brand new baby.
Yes.
In your skin.
It's that bouncy skin.
The tightness of your skin, that like rebound. So starting in our mid-20s, late 20s, 30s, we lose 1% of collagen
every
per year that we're never going to get back. Remember, collagen is the structure and the strength of your skin.
Correct.
So you can do all the things, but if you've lost the collagen, you might not feel like that oomph that you're looking for.
So really, I love using Sculptra. It's been just one of my favorite products. It's been a go-to for me for building that collagen back up and really tightening. Yes, I see that in quotes. Tightening the skin or improving the appearance of the skin, because when you do have that laxity there, I think that's where Sculptra shines in just being able to give thickness back to the dermis so that things appear tighter.
I agree.
And it's just great for jawline definition. Yes. I've really seen amazing benefits there.
Yeah. Because like I said earlier, we know that we're losing bone here too. So if we can build some collagen through here and keep this skin almost like a sports bra.
Like a tack back. Yeah.
Right where we want it to stay. Yes. Well, then we're great. A tip, if you get your masseters injected, which we both do, and
I know, and I look in the mirror every day and I'm like,
if you're a little bit prone to jowling, a fix for this can be adding a little bit of Sculptra per year to your lateral face. Ask your injector about it. We try to do a good job in talking to our patients about what masseter Botox can and can't do, risks, benefits of it. So
and that
Sculptra is a great way.
that was circulating around TikTok a lot, actually, is masseter Botox causes jowls. Well, it doesn't.
Well, it doesn't.
Yeah. So, but what happens when you inject the masseter is you're making that muscle smaller. You are taking, and we'll show you our before and afters from masseter Botox because it's changed our face shape. It's amazing. Yeah. It shrinks the muscle. It really gives you a nice shape, but it's not causing the jowl. However, just like Megan said, it does support the skin. So if you decrease the bulk of the muscle, that skin has nothing to support. And now that skin is just a little looser. It didn't cause a jowl, but it just not holding it back. So Sculptra, yes, makes a great
Or just don't inject them.
impact.
I mean, it's not forever.
Yes, right. If you don't, they take a while, but like if you don't inject someone for 6 months, that little bulk will come back and that girth of the muscle will come back for sure. So
okay, so we were in the deep dermis and now we're
gonna be in the muscle
layer.
Yeah, we're gonna skip the superficial fat because
well,
we don't play in that pool.
We don't. Yeah, we'll leave it at that.
It's not that it's bad. I think it can be done well. Sometimes I just dissolve a lot of superficial filler.
You have to have the right product. You have to have incredible precision. I've done it. I've dissolved it.
Yeah.
I think I can get the same result with deep injections into that deep fat and on the periosteum, which is bone, and we'll get to that.
Yeah. So muscle, that's where we love neurotoxin. Those are my, I love my tox patients. We go top to bottom and they have just phenomenal results.
Yeah. I mean, I love it's a toss up between skincare and Botox.
Yeah.
I've just seen people's skin transform when they don't have these deep lines on their face.
Yeah, and it does give you just such a pretty glow.
Yeah, it does.
So it does, improves the skin quality by working on those like erector pili muscles, which are just like fancy terms for like little superficial like cells on the skin. But it really smooths out, it just like brings a pretty glow to the skin. And you can use it for so many things.
Like we said, you can fix the downturn in your mouth. You can fix the pebbling in your chin. You can actually make your jawline look tighter. And then we all know what the upper face does. Another tip, please don't treat your upper without treating your lower. Your lower is actually, in my opinion, aging faster. Like I see a jowl on people more quick or like more readily than I see
their fine lines up there.
Yeah. So
especially when you get to mid-30s, unfortunately. Mid-30s and later, though, I start treating almost everyone in their upper and lower face. It doesn't have to be your entire neck, but just starting to treat some of those muscles, just like the corner and just like the chin.
If I was going to say, if you are that 30-year-old that wants some definition here.
Oh, yeah, it's a great way to do it.
Ask your injector about adding on, DAO or Nefertiti. You'll love it.
Yes. And I think this is important for injectors. I saw a patient the other day who got her DAOs, which is the corner of the mouth, this little triangular muscle here. She got them injected, but she did not have her chin injected. And I think that this is something you can't do that. You can't inject the DAO without injecting the mentalis. You can inject the mentalis without injecting the DAO, but on her, she came to me and she had this really nice, pretty neutral smile, but her chin was so hyperactive that she had so much pebbling because her muscle was pulling up. So you've treated a muscle that pulls down naturally. When you Botox it, it's now going to lift the corner of the mouth. This muscle here naturally pulls up. So you have to counteract it and let it pull down. Yes. Otherwise, you're going to have too much pulling and then you get some pebbling there.
Agree.
So I think that's important for injectors.
I always tell people it's like a seesaw.
Yes.
I completely agree with you. If you treat the DAO, you have to treat the chin. You can treat the chin without treating the DAO. It is a seesaw. I play around on my assistant Maddie a little bit, and we do fun things where I would like test that.
Yeah.
But if you were my patient, if I'm recommending DAO, we're going to do a little in the chin. And 10 times out of 10, you're going to love it.
Oh, absolutely.
Okay. Last bit. This is one of our powerhouses. This can bring back your youth if it's done properly, and that's volume replacement with filler.
Yes. So everyone at some point is going to need volume replacement. It's just going to depend on if you're willing to take take the plunge, right?
Yeah.
Like you get the same spiel over and over again. I'm scared I'm going to look different. I'm scared I'm not going to look myself. Like, I don't want to be puffy. Like, well, duh, neither do I. And I
Yeah.
don't want you to look like that either.
Yeah.
So what? I feel like people just need to throw it in there so they feel like they've told you. But if you're going to somebody who, when you look at them, you like the way that they look, you're in good hands. If you go to somebody who unfortunately has really overfilled lips and overblown up cheeks, like,
that's probably how you'll look.
Yeah, that's what they think looks good.
Yes.
So you have to be very cautious about who you're choosing. But if you're in the right hands, like, filler is magical. It's truly magical because you can see it right before your eyes change in an instant.
Mm-hmm. And I think that's why we love filler so much, is because that result can be dramatic and instant. I don't know why it has such a bad rep right now. I think it's that viral MRI that went around, but I want people to know that the viral MRI that showed basically filler
All over the place.
migrates a touch, but had lasted her for 10 or more years. Does anyone know how she looked? She looked fabulous.
Right.
So she actually looked fabulous. That MRI was actually not to show any like bad thing about filler. It was to show you that it lasts longer than you think. But if you actually looked at that photo of her, she looked amazing. So filler, I don't think migrates, maybe a little bit in the lips, but it doesn't have like these shoes that it puts on and just like walks around here to here. You know, it gets displaced a little bit, and this I think can go back to like how your injector injects it. If they're using the right product, the lips tend to migrate, you know, a little bit more than other places. But let's not demonize filler because of one like viral MRI in which the patient actually looked fabulous. Let's like use it where we need it. And we can walk through those areas where we need it. But that volume replacement you get from filler can truly like make you go from 50 to 45.
Yeah. It's not the, it's not the injection, it's the injector. Like,
Agreed.
That's how you look unnatural.
With anything.
Let's not blame the filler. Blame the person filling.
Let's not blame the laser. Let's blame the technician. You know, it goes back to that. So where we typically focus our filler treatments are, we'll start top down. Mm-hmm. Temples are trending, and because they got an FDA approval,
they did
by Allergan for the temples. This is such a sneaky area to get filler for you to still look like yourself, but look like you're a few years younger. Yeah, the hollowing that happens in the temple can be pretty intense on some people and really age you.
Yeah, and it lasts a long time. So the injections there will last you for a while when you put them in the right place. They really help to lift the brow. They help to support the brow bone. If you're really starting to notice that like bone off to the side of your brow, doing a little temple filler will help to blend that back in and give you that nice oval shape that we want. Peanut heads are out.
They are.
Ovals are in.
I had this beautiful young patient come to me this week, and she had been getting filled on her lateral cheek. So at 24, I really don't think that she had a true temple volume loss. Right. What I think it was that her lateral cheeks were filled so much that it looked concave. It looked like she had volume loss in her temple, and that's where you see that peanut head. Right, that little ripple. We discussed it, but
and it's interesting because lateral cheeks were like the first area that you honestly learn how to inject filler, and I would say 80% of my practice I don't inject lateral cheeks. Yeah. I inject a ton of medial cheek because I just feel like that there's so much beauty there, but we don't really put a lot of product in the lateral cheek.
Agree. So temples, mid-face.
Mid-face is huge.
Huge. This is where we get beautiful, apple support, under-eye support, filling in this flattening.
Yeah, but it looks so good. I've been looking at it.
Oh, have you? Uh-huh. Lauren put a syringe of filler in each of my cheeks.
Just in the front, yeah.
I am flatter. My anatomy, my bone, when she
I was like,
I don't mean to be like graphic, but when she stuck the needle in, she was like, oh my gosh, Megan, my needle hub is all the way to your skin.
I know.
So, anyways, this is
That's an area that you get a lot of rejuvenation. It helps the under eye tremendously, and I would say 9 out of 10 times you fix the front of the cheek, you don't have to touch their under eye. And
agreed.
now we have PDGF, and so I hardly use filler to go into the under eye whatsoever,
Yep.
and it just makes a huge difference. And I think the front anterior cheek is my one of my favorite areas.
Agree. I also think that it helps so much with that piriform, that nasolabial fold. We also
You don't need a
get
lot of product here.
no. We get true bone loss here. So you'll start to see sort of like this widening, almost in a triangle by the edge of your nose as you're aging. So we need to refill that
Yeah.
because you're nothing is going to change that. So I love starting here at the cheek. It's not going to lift, but it's going to change the light contour and reposition those fat pads a little bit.
Yeah.
And so you'll need less filler here. We don't want to double down on filler through here. You'll look sort of heavy and like a monkey.
Yeah. And then we can inject back behind here, jawline, and then right in front of the ear. So again, kind of along with that peanut shape, you can kind of get that right here too, where you're like concave, full, and then concave again.
Yeah.
And that really is more skeletonized and less youthful.
Agreed.
So full faces really look youthful, and really thin skeleton faces don't. So these are two areas that I really love to enhance and put volume, because it does make a huge difference.
And I think they're sneaky.
I
love sneaky areas
and you don't
to
have
put
to use
filler.
a lot.
Yeah, you don't. Again, temple, lateral face, like Lauren said, no one will know you got filler here. They'll just know that you look better. You look a little bit refreshed. You don't have that hollowing.
Yeah.
Sculptra is good in this area too. So another sneaky area that Lauren and I absolutely love, maybe
Favorite
one of
area.
our favorites, she
The
knew what I
chin.
was going to say, is the chin.
Yeah, definitely. I was filming yesterday, content day, which was so fun. I loved doing that. And Stephanie was asking me, she's like, what's your favorite area to inject? I was like, the chin. Easily.
Easy.
She's like, really? That's not what I would have thought. I was like, absolutely. It makes the biggest difference.
People don't realize that they come in and they want lip filler, or they come in and they're like, I just want to look rejuvenated, and they don't realize that either their chin is recessed, that their muscle is pulling and they have all this cobblestoning, or they just genetically lack the projection and the volume in their chin that they need to create sort of like that heart shape. That's kind of what we're going for. We don't want everyone to look the same, so you're not like going based off of like what is beauty, what is not.
Right.
I don't like that.
It's for your face.
Yeah.
It's proportions that match your face, right? Like I really look at the thirds, right? And that'll help you to figure out, does this person need length? Do they need projection? Like, do they need anything at all? Like looking at those things make it specific to that patient, instead of just being like, okay, it's one syringe for Sally and Julie and, so-and-so. Everybody gets one. And then, you all start to look the same. And that's how you start to look funky and alienized. But the chin is beautiful.
It is.
It's such a good area. And the chin shadow is probably my second favorite, because really blending the filler from the chin to the cheek to the jawline is what makes you look very airbrushed and kind of flawless.
Yeah, that's your facial balancing.
Yeah.
And another tip, I've been doing a lot of tips. If you go in and ask your injector to do lip filler and they're not assessing your lower face, this could actually throw off your proportion. So we're always assessing the full face. I love lip filler. I also think that's an area that most people will probably need some filler. It doesn't have to be crazy. It's truly like almost a lip glazing, a lip hydration that most people will end up needing, and I put that in air quotes.
Right, but if your lips look like a raisin, then it is volume loss in your lips. Like, refill them. Yeah. You don't have to get big Love Island lips, but like just hydrate them.
That's what I want.
I know. Oh. Megan could use like actual filler. She just wants hydration though.
I want some lip filler, I think.
I know.
Hydration. I think I want hydration.
Like you could use, you think you could use more.
You want me to have bigger lips.
No, I don't. No, I don't. But I think we could do some refine. You love refine. You use it all the time.
I love refine. I love building my patient's lips.
I know.
I'm a big stickler when it comes to lip filler, so.
Okay, so that is the art of a consult. It's quite in depth, but that is what we are thinking every single consult. When I sit down with somebody, I'm going through every single thing that we just spat out to
Yeah.
you. I'm going through that with them and then making their plan. We have a whole like year calendar that we plug stuff into. I put on there for your Botox to be every 4 months. I put on there for you to do your skin treatments. I put on, you know, what to do for Sculptra, and then I add in your volume replacement. And typically that's broken up depending on like age and what we're trying to do into 1 or 2 sessions, depending.
Mm-hmm. Mm-hmm.
And then by the end of that year, I think that you've got a really beautiful transformation and a really beautiful rejuvenated face. You've done good skincare, you followed all the treatment plan, and then from there, maintenance is super easy.
Mm-hmm. And maintenance comes once or twice a year.
Yeah.
Filler is actually buildable, so it will expand a little bit in your face until you'll need less and less. We don't need to do a full facial balancing every year. You can get away with not doing that for multiple years.
I know.
I did want to add in something that I know both you and I do that we're not scared to do is if you, one, are open to surgery and two, need surgery and we cannot correct your heavy jowls or your aging with non-invasive treatments, then we will absolutely recommend surgery.
Yeah, for
so
sure.
we're not scared to do that. You just, you know, and that's something that I typically will bring up in the beginning. Hey, are you open to surgery? You know, what's in our playing or what's in our pool that we can sort of grab from?
Yeah, so key takeaways here, you know, really invest in your skin and your skin care. And then go to an injector who's willing to give you a full treatment plan. So don't just shop around for someone who's willing to just like pop the Botox in there and send you on your way. Really find somebody who you connect with, that you vibe with, because that's the person that you're going to kind of hopefully be with for a very long time, and let them guide you. Pictures are worth 1,000 words, where we take tons of before and after. So I think that is key.
Yeah. And I think going in with an open mind too, we don't pick things out because we think you're ugly or like need all of this.
You're ugly.
It's truly to educate you. That is my goal at the end of the day. I typically ask people, hey, are you okay with me going from top to bottom just to educate you? I always say, having things in our back pocket is the best thing we can do, because maybe you're not interested in filler right now, but at least you know your options. I'll write it on your treatment card. We can still plan out without filler. We can work on your skin first.
Right.
But going to injectors that have a skin forward approach with a full facial balancing approach as well and plan, I do think will keep you looking like yourself.
Absolutely. All right. Well, I think that was a great episode. I love consults, and we will see you guys next time.